Hello wonderful people, welcome back to my channel. It's Jovita Abala again, and I'm here to bring you week 12 of pregnancy. If you've not been watching this video up from week 1 till this moment, now you might want to check the previous videos so you don't miss out on anything. There is no knowledge that is lost. So without further ado, let's get right into the video of the day. So if you are in week 12, you are in your 3rd month of pregnancy. So you have like 6 more months to go. This may be the end of some pregnancy symptoms for you as you drag towards the end of your 1st trimester. So at this stage, your uterus becomes about the size of a large grapefruit. It begins to move from the bottom of the pelvis down to the abdominal front, or do I say up to the front of your abdomen. Your baby bump. At week 12, your baby bump becomes more obvious to you because your clothes don't fit. And remember that your uterus has left the pelvic area and is now at your abdominal front. So this is the reason why you're feeling this, why is it that my clothes don't fit anymore? Your baby's growing. The size of your baby bump is actually determined by your size as a woman, your shape as a woman, and it also depends on if this is your 1st pregnancy or a subsequent pregnancy. So do not beat yourself up if your pregnancy doesn't look like that of your friend, or let me use the word, your baby bump. If your baby bump doesn't look like that of your friend in the same stage, or that of somebody you may have seen at the same stage, you don't have anything to worry about because there are different factors that determine the size of your baby bump. Feeling dizzy. The moment you hit 2nd trimester, you might discover a new symptom of feeling dizzy. There is none other than progesterone responsible for it. Progesterone causes your blood vessels to relax, but when it's week 12, it starts expanding. And that will in turn increase the blood flow to your baby. And when that happens, who wouldn't feel dizzy? So when progesterone increases the blood that flows to your baby, this might result into a low blood pressure for you as a mother. And that's the reason why you feel dizzy. When you have a low blood pressure, it affects your brain. Not like your brain is seriously affected, but the fact that there's a low blood pressure would have an impact on the brain, which would result into lightheadedness, and then you start feeling dizzy, especially when you get up forcefully or you get off your bed forcefully. So that's the reason why it's advisable for women to take it gently whenever they're pregnant. Another cause of dizziness during pregnancy is low blood sugar, and this occurs when you don't eat. I'm feeling queasy. Oh, I cannot eat. I threw up. I do this and I do that. Hey, do your best possible to eat. Eat something. Let something enter into your mouth. Try fruits. Try dry fruits. Try all sorts. Whatever it is that comes out palatable to you. Even if it's not, if you can tolerate it, go ahead and try them. And I mentioned earlier that oats is extremely good for you as well as milk. So do explore a lot of things and make sure you eat something, otherwise you'll be having a low blood sugar, and that will result also in dizziness. So my dear, do not engage in any activity on an empty stomach. A quick tip for dizziness: the moment you feel dizzy, just lie down. But if you can't lie down, sit down and put your head low between your knees. Take a deep breath, and whenever you feel better, get something to eat. Low sex drive. In some cases, some women do experience a boost in libido whenever they're pregnant, but some other women cannot even entertain the thought of it when they're pregnant. It's all about the hormone. It depends on you and it depends on your hormone. Don't go killing yourself. Don't worry yourself. People differ and they respond differently to hormones. Now, in a case where you can't eat, you're throwing up, you're feeling restless, you're feeling ill, would you want to think about sex? But when it comes to a woman who is not affected totally by pregnancy and maybe probably recovers on time or just has little symptoms and it's okay, well, such a person can actually think about sex. So hormones deal with us differently. There could be a spike in some people and a decline in some other people. So what are you going to do about it? Like I said earlier, pregnancy symptoms can come in the way of you and your good time. The most important thing to do is to keep yourself emotionally connected to your partner because the hormones might let you go tomorrow. How connected are you with your partner? I hope you won't just screw the whole thing up and start trying to mend ways because you are now feeling better. Isn't that selfish? So allow your partner to understand what you're going through so that your partner can engage with you. Then the moment you get better, you're both happy. Exercise. Although exercise may be the last thing you're thinking about when you're worrying about a whole lot of things going on inside your body, outside your body, physically, emotionally, mentally, everything. But staying beauty fit is actually good for you. And there are many advantages attached to starting a beauty fitness routine. Pregnancy symptoms such as backache, constipation, sleeplessness, and cramps may be eliminated. Secondly, due to the release of natural boost enhancing chemicals called the endorphins, you might end up being extremely happy, and that translates into a boost in sex drive. 3, you will return to your prenatal shape more easily and quickly. 4, labor will be easier and quicker, especially if you engage in pelvic wall exercises. So with that being said, you can try out the following exercises: forward bend, tummy tuck, back twist, and lower back stretch. Please, 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 I am not an exercise specialist. Please do a research on these following exercises. Yes, I have done a research on them and I've seen how they are being done. So what you have to do is do an extensive research and see how they are being done so that you follow the steps involved in doing these exercises so you don't hurt yourself. And whatever you do, make sure you consult your doctor first and follow the rules. Please follow the rules. Note this: don't sink in your back during exercise as a pregnant woman. You should start antenatal classes. It's better booked earlier. So now, what happens to you, mommy, in week 12 of pregnancy? Your uterus, which is getting bigger, can now be felt above your pelvic bone. Your weight and abdominal shape is beginning to change, but others might not notice it. So what happens to our baby? Your baby now has 32 buds in his mouth from which the teeth will form. Your baby is beginning to produce blood cells in the bone marrow, the spleen, and the liver. Your baby is beginning to respond to external stimuli such as noise and movement, and your baby's full eyelid has formed. And now that's the reason why you are advised to be in the best of your mood whenever you're pregnant. So your baby knows it when you're sad, your baby knows it when you're happy, your baby knows it when you're worried. So mommy, always keep the best mood for your baby. The umbilical cord is now divided into 3 parts. One carries oxygenated blood and nutrients to your baby, and the other 2 carries away the deoxygenated blood and wastes. So that is it for week 12 of pregnancy. If this has helped you in any way, if you have learned a thing or another in this video, why not smash the like button and give us a thumbs up? And if you're yet to be a subscriber and you want to see more of this video and learn more as you go in pregnancy, hit on the subscribe button and don't forget to hit the bell so that you get notified whenever a new video is posted. Thank you for watching. I'll see you in week 13.